Welcome to the Superpowers for Good show. I'm your host, Devin Thorpe. Mark Gerson is a devout member of the Jewish faith. He hosts the Rabbis Husband podcast. He is also the chair of the Christian nonprofit African Mission Healthcare, which is saving lives in Sub-Saharan Africa. He'll also share about his superpower, having a focus on ROI as a philanthropist. Mark, thank you so much for joining me today. It's just a thrill to have you on the show. Thank you.
Oh, it's great to be here, Devin. Thank you.
Well, the pleasure is all ours, but let's start off by talking about African Mission Healthcare, this organization that you chair and have been a key financier of as a philanthropist. Tell us about it.
So in about 2001, my closest friend from college, John Fielder, called me and he said he was just finishing up his residency program at Johns Hopkins. Having, of course, graduated medical school, then Hopkins, finished a residency program, called me and he said, as you know, I'm a Christian. And I said, yes, I know. Okay. He said, well, as a Christian, he said, I could be doctor number 700,000 in the U.S. Or he said, I feel the call to go serve people who are suffering and dying from AIDS in Africa. So I'm going to go. And so John went in the early 2000s, 2001, 2002, and has been a Christian missionary physician there ever since. And one of the many things that I learned from him, and everything I know about the healthcare situation in Africa, and in fact, everything African Mission Healthcare does derives ultimately from John. But one of the many things that I learned from him is that probably the greatest humanitarian problem in the world is the lack of access to care for almost everybody in Africa. And if you go through the data, you'll see that there's one doctor for every 10 to 50,000 people, typically in Africa. It varies country by country, but it's often 1 to 10 to 50,000 people, which means practically that if your child falls and breaks her leg, if you or your wife needs a C-section, if you need any kind of cardiac care, any kind of surgery, any kind of infectious disease care, it's very rare to be able to have consistent access to any kind of treatment. And the same, that's true of the small number of doctors per population, is also maps the hospital services. So for instance, very few hospitals in Africa have piped oxygen, which is just one example of the kinds of things that we totally consider table stakes that's just absent there. So I learned from John, this is a massive problem, but it's also an incredible opportunity, because the people on the ground who are doing the work to bring care to the African poor are Christian missionary doctors. And they're there throughout Africa, and they're at Christian mission hospitals, and they're building them. The problem is that they have no consistent source of support. And that support is financial, it's engineering, it's training, it's infrastructure, it's all kinds of things. There used to be a lot more support from the denominations, but for a variety of sociological reasons, the denominations have become poorer and weaker, and no one picked it up. So in 2010, John and I were having a conversation, and we said, well, why don't we pick it up? So we said, let us be the partner for these Christian missionary doctors serving at Christian hospitals in Africa who are literally doing God's work, and we'll be their partner for infrastructure, for training, for finances, for clinical care. And in so doing, we will bring massive amounts of care to the African poor, while importantly building the systems that will amplify care long into the future. And that's what African Mission Healthcare does. We're now active in 14 countries in 3 areas: clinical care, infrastructure, and training. Clinical care is seeing patients. Infrastructure is the construction of things from oxygen, which we talked about briefly, to power, reliable power, to sometimes running water. Sometimes, because of the investments that we make and the building that we do in conjunction with the Christian doctors, more and more patients will come, but the same road will be there. So we got to expand the road. That's a classic infrastructure. One of the most important assets in an African healthcare environment is trainees, young people who graduate medical school and want to come and be trained. And if a hospital should receive such a person, it's just like it's a treasure. And then imagine receiving such a person and realizing there's nowhere for them to stay. literally nowhere for them to live because there's no private housing market and there's no housing on campus. So often it's like the thing that you've been dreaming for, that you've been hoping for, a trained person, two people coming to be trained. Because in healthcare, training is not a one-way thing. It's you get trained by doing the thing, right? So it's someone is assisting with surgery, then they gradually do more and more, and that's the training, but they're actually serving patients while being trained. So it's a win-win, but imagine if there's no place for them to stay. So then we'll come in and build housing. So it's clinical care, infrastructure, and then training. And training is a part of both clinical care and also factors sometimes into infrastructure. So those are the three things we do. We're active in 14 different countries, and it's very exciting because we're serving hundreds of thousands of patients while really building the systems and the structures that are massively improving the healthcare for Africans now and long into the future.
There, you made an interesting leap in backing this, and it's remarkable, and it's one of the reasons that people talk about you, right? It's because you are a committed Jewish man who has funded a Christian mission.
I'm married to a rabbi.
That's right, married to a rabbi.
Right.
Which we should use this segue to plug your podcast, right? Your podcast is called the Rabbi's Husband, right?
That's right. That's me.
Yeah. So people can find that, I imagine, in all the regular podcast places. But it would seem to me logical for you to have some of the same concern that many people, even among those of us who identify ourselves as Christian, still struggle with when we think about doing humanitarian work. And that is around the fact that the mission of some Christian operations seems to be split between the humanitarian care and proselyting or proselytizing. Mm-hmm. And I wonder how you address that concern, or have you? I mean, how did you think about that?
Sure. Well, I mean, first, your presumption is totally right. In your first presumption, which is we are deeply committed Jews, traditional, deeply committed Jews. My wife is a rabbi. Our kids are all 4 of our kids are in Jewish day school. We are deeply committed Jews, and as deeply committed Jews, the Torah, 5 books of Moses, tells us 36 times more than anything else that we are to love the stranger. So as serious Jews, we have to say, well, how can we discharge that biblical obligation to love the stranger? And when we ask that question, it's answered by Christian missionary doctors. So these Christian missionary doctors help make us better Jews. Now, you ask a very interesting question about proselytizing. So, or really even more broadly, what does it mean to be a missionary? Which is the question that we've asked missionaries now for 15 years. What does it mean to you to be a missionary? Why are you devoting your entire life going without, forget luxuries, definitely that, but what we would consider necessities to go into places like rural Burundi, to go into Malawi, all places we serve, often places without obviously consistent healthcare, which is why they're there. There may not be a school nearby, there may not be consistent power, there may not be consistent water, yet they go there to serve. And we say, what does it mean to be a missionary? And what they consistently say is what it means to be a missionary is that we ask ourselves, what is our mission on earth? This is them talking. As Christians, we ask ourselves, what would Jesus want us to do? What would Jesus do if he were me? And this, of course, is not me talking, it's them talking. And they say, well, the answer is very clear. It's like Jesus or God wants me in Malawi, wants me in Kenya, wants me in Tanzania, wants me in Cameroon, Uganda, the Nuba Mountains. And they all, I must say all, but seemingly all, at least all the ones I've spoke to, have a story about how they got there, which involves what secular people would call a coincidence. Now, I don't believe in coincidence. It's just a secular expression for something we can't understand. It's God directs the world. They certainly believe that. I believe that. I as a Jew, them as Christians. And so there's always some set of circumstances, which some people would call coincidence, that an email comes in from a long-lost contact that suggests they check something out either online or call someone, and then all of a sudden it becomes clear to them that this is not a coincidence, this is a deeply meaningful experience, a message from God that he's asking them to go serve in Tanzania, Kenya, Malawi, wherever. But what it means to be a missionary, in the words of the missionaries, is to fulfill one's mission. And in their case, their mission is to deliver healthcare to those who would otherwise be without. Now, I did in Tanzania. I was in Tanzania a couple of times, but the first time I was in Tanzania, I asked a missionary, a truly great man, Dr. Mark Jacobson. He had been there at that point for 31 years or so, and totally devoted his life to building Arusha Lutheran, which is a spectacular hospital now, and he's devoted his life to serving the poor, building the institution, training people, everything African Missionary Healthcare does. We've been fortunate to partner with him, and so I was with him for a couple of days, and at the end of the second day, I said to him, "I've learned a lot from you. I've seen a lot with you, but one question I have that has not been answered at all is, what is missionary like about what you're doing? Because you're a Christian missionary doctor, but I haven't seen anything that I, as someone who's a step removed from the missionaries, would consider missionary, let alone people who don't know any missionaries. Like there's." He said, "What do you mean?" I said, "Well, you didn't talk to anybody about trying to convert them, and nor did you talk about having talked to anybody about trying to convert them. It hasn't come up in 2 days." And he said, "Oh, you can only have that conversation when someone says one thing to you." I said, "Well, what's that?" He said, "When someone says, 'Why do you care so much?'" I said, "What do you mean?" He said, "That line of discussion is only open when someone says, you could be anywhere. You could be a wealthy man. You could be living in a prosperous suburb. You could be doing anything. And yet you're here serving in these conditions, working these hours, taking call at all hours, working in a hospital without many things that almost all Western doctors would consider necessities. Why are you here? Why do you care so much?" He said, "When someone says, 'Why do you care so much?' you can open up the conversation." I said, "Well, how often does that happen?" He said, "Not very often." He said, but why does it happen very often? I saw this when I was in Kenya, because I was in another mission hospital we support. And the people I was with said they wanted to introduce me to the surgeon. So they took me to see the surgeon. There were 10 hours of patients waiting to see him. They're not having in-depth theological conversations, literally 10 hours worth of patients waiting to see him. Because as we talked about before, there's so few surgeons. So when they get access to one surgeon, the line goes for days. Maybe it's 1 day, but it was 10 hours. So they're so busy seeing patients, and these patients have been suffering, many of them for so long, with conditions that would be fixed tomorrow here in New York or where you are in Salt Lake. But what it means to be a missionary is really about fulfilling God's mission for them, which led me to believe that any of us can be missionaries. Not like them, but because not like them. That's, and I'll talk about that for a minute. I mean, I remember I was in Kenya once, really observing what these Christian missionary doctors do, and I said, these are the best people in the world. Like, these people are to morality what Michael Jordan is to basketball. So I said, look, it's just, they're inconceivably good, literally inconceivably good. So I remember saying to myself, like, I can never be as good as them, but I can support them. And then what they would say is, and they said this to me and to Erica, my wife, they said, without you and donors like you, and not even at the level we donate, but really at almost any level, they said, without donors, we'd be working with Band-Aids. And so I realized that I'll never be as good as these Christian missionary doctors, but I and anybody else who wants to join us could be their really indispensable source of support and partnership. Not really just support, but partnership. And without donors, they'd be working with Band-Aids, which means they wouldn't be working, which means all these people wouldn't have care.
Yeah. This is really an amazing and inspiring story, and I appreciate you sharing it with us. I know that there are some in our audience who are nonprofit leaders who, quite frankly, are a little bit salivating at the thought of finding a Mark Gerson. What advice would you give them for finding someone that would back their efforts the way you have backed Africa Mission Healthcare?
Well, in our case, in the case of Erica and me, it's really it's the and I'm sure we'll talk about this in the second part of the segment too. But it's really about the return on investment that we get. That's how we think about it. And that's not how everyone thinks about it, but it's how we think about it. What's the return on investment? When we make a financial investment, we do what everybody else does and ask, what's the return on investment? So the methodology to make a philanthropic investment should be the exact same. So why are we drawn to African mission healthcare? Well, there are a lot of reasons, but the primary one is that let's take a C-section in Uganda, which is kind of the classic thing we do. $232 for C-section in Uganda. If a woman, a woman throughout many places in Africa has about 20% chance of getting a C-section if she needs it, which means she has about an 80% chance of not getting it if she needs it. And my wife had 4 C-sections in New York, there's about a 100% chance of getting one if you need it. But if it wasn't even a thought with us, like, will she be able to get the C-section? It wasn't even But in Africa, 20% chance. In many parts of Africa, probably not all of Africa, many parts, 20% chance. It means 80% chance of not getting it. What happens if you need it and you don't get it? High chance of death. And there's a reason in the Hebrew Bible why it says in the Cain and Abel sequence, the bloods of your brother cry out to me. Why does it say bloods? Bloods is plural. Shouldn't it be the blood of your brother? No, because when Cain killed Abel, or when you save someone, more than one life is either killed or saved. No one ever saved one person. No one ever killed one person. It's always a multiplier effect reflected in the biblical language. So take a woman who's, 26, 27 years old. She needs a C-section. If she can't get it and she, God forbid, dies, she dies. Her baby may or may not die. But what's the quality of life going to be like for her surviving children at home? $232 will get her that C-section. And if she survives, she will get either a fistula or a birth injury tear, which are completely devastating, which will degrade the quality of life beyond what any of us can imagine. And it will only be fixed upon surgery, but there are no surgeons around. So for $232, what's the ROI? $232, a little more expensive in some places, like $400 or $500, like not meaningfully more, given the scope of what can be done with them. So what's the return on investment? For under $500, sometimes well under $500, we can assure a woman the safe delivery of her baby. The ROI is spectacular. One can actually run the numbers on everything we do, we run the numbers on the life expectancy, quality of life, number of years. We have all those numbers, but the ROI is just spectacular. So when we give, we think about what's the ROI, and African Mission Healthcare offers the greatest ROI in the world. Anything, whether it's financial, commercial, or philanthropic, best ROI in the world. So we think, what's the ROI? And we were able to see it up front, but actually we saw it up front later. I think I made my first trip to Africa in 2016, and we started the foundation in 2010 because John had been living there. John had been living there since the early 2000s, and John built a team in Kenya. So we had a robust team, and I knew about it because John and I talked and emailed every day to this day. So I knew about it secondarily through him. But I suppose that's another aspect that will be of interest to the nonprofit leader, is he and I had such a deep, close, and trusting relationship that then when I started to go over there, I saw it with my own eyes, but knew the problem beforehand. And the ROI was just overwhelming. So it's, anytime we can make an investment in African Mission Healthcare, we do. Just like if there was a financial investment, whereas like if you invested $1,000, like you were sure to get $1 million out like next month, like how many $1,000 would you put into that machine?
Yeah.
As many as you possibly could. So that's the way we look at African Mission Healthcare.
I think that's a brilliant model, and I hope more philanthropists will think about that, as well as the nonprofit leaders who are trying to access that capital. So thank you for sharing that. Mark, what is your superpower?
Oh, well, I don't know if I have one, but I would say it's what we just talked about. It's a focus on return investment when applied to giving that I execute on. So, and I mean execute on it. So it's so I don't know if that's a superpower, but it's one of the things that we try to missionize, we try to evangelize is exactly that, is that take the same methodology and discipline that every business person applies to any financial or business decision and just apply it to philanthropy. And I think we do that very well. I mean, I think we do it great. I mean, it's both with African Mission Healthcare and with the other charity that I co-founded and chair, United Hatzalah of Israel. I mean, both deliver spectacular ROI, have been able to inspire other people to come and join us on these sacred missions where so many lives are being saved, radically improved, and completely transformed because of financial gifts. And so I would say that's one of the things that we're really most proud of and most wanted to share, is that if anyone can give, and really at any level, I mean, $232 for a C-section, and you just have to have a little imagination to imagine a woman who could be the age of someone listening or the age of someone's listening's daughter. Imagine if you or your daughter, depending on what age anyone is, needs a C-section and can't get it. Now, and then consider the Waldorf Astoria, the hotel here in New York, used to be called the New York Fistula Hospital.
Oh.
And then why did it stop becoming the New York Fistula Hospital? Because there are no more fistulas in the West. Why? Because people who needed C-sections got them.
Yeah.
So, but imagine, God forbid, just look up fistula online, look up birth injury tear. Look, imagine what would happen to a 26-year-old mother if, God forbid, she died, and what happens to, obviously, her, but her other children. $232. So one does not need to make a huge financial investment to make an enormous difference when one thinks about giving through the lens of return on investment. These opportunities, I mean, just like any good investment, they may be hard to find, but okay, anything worth doing is challenging, right? They're not that hard to find, by the way. Like, this is one. I mean, anyone listening just found one. But I was gonna say it's a great feeling. Yeah, it's that, but it's just a great set of facts. It's really a great reality more than it's a great feeling. It's a great reality to know that for $232 in one place, for $400 and whatever dollars in another place, you can completely transform someone's life and the life of everybody they affect. And that's just ROI-based philanthropy.
Yeah. How did you develop that superpower?
I think I developed it really so that these two charities that I co-founded and chair, United Hatzalah of Israel, and what we do at United Hatzalah of Israel is this was really the brainchild of Eli Beer, entirely Eli, who is just one of the greatest men in the world. He, when he was a young man, he was volunteering on an ambulance in Israel, in Jerusalem, and realized that, he said, I never saved anyone's life, 2 years. He said, but I got to a lot of dead bodies, but I never saved anyone's life. He said, and then I realized why. He said, when I went, I got a call to go to the home of a child who was choking on a hot dog. And we got there and the child was dead from having choked on a hot dog. And then this guy comes by and says, what happened? So Ellie says, it was then a young medic. I told him, and he says, do you know I'm a doctor and I live next door? And then this said to Ellie, all right, this situation is intolerable, that there could be people who are trained, could be equipped, and they could be notified about emergencies in their immediate vicinity. And all we have to do is get them there. And then the ambulance, it wasn't like Israel had a fine ambulance system. It takes ambulances anywhere in the world 10 minutes to get to the victim. New York City, Salt Lake, Jerusalem, that's the best, because ambulances are too big to be fast and they're too expensive to be ubiquitous. But Ellie's insight was, you don't need an ambulance there immediately. You need a trained and equipped person there immediately. So we built this system, and we now have over 6,000 volunteers in Israel from every sector of Israeli society, Jews, Muslims, Christians, Arabs, everybody, all devoted to getting to victims in the moment to separate life from death. So when I saw that, and so there, we're saving lives for under $500 a life. I mean, when you look at the number of lives, we're saving about 200 people a day. The budget's a little over 30 million. I mean, it's so when you see that you can save someone's life either in either of these two cases we've discussed for that amount of money, you're like, this is just the best investment one could make. So the fact that we just started making these investments and they were just the best investments we will ever make led us to kind of step back and say, okay, what did we actually do and what are we doing? We said, we're doing ROI-based philanthropy. Like we realize now that there are opportunities out there. And just like in business, the opportunities, they're rare, but they're there. And if you find them and you deploy capital at any size, you can create enormous difference. So in our case, it was about seeing it and then realizing what we were doing, and then now trying to, well, obviously keep doing what we're doing as much as we possibly can, as well as spreading it, that this is the way philanthropists should think. And I think that when nonprofit leaders can really demonstrate the ROI, and in both cases of United Hatzalah and African Mission Healthcare, we get very detailed. Like we can get as ROI detailed as any investment banking analyst talking about a company. Just because that's where it's the same thing. We'd like you to make an investment in saving lives here, and here's why this is such an effective and efficient system to do so. So, and does good feeling come out of it? Of course, but good feeling derives from the facts.
Yeah.
And now, of course, some people respond more to facts, some people respond more to stories, but the stories are facts. So it all comes back to the facts. It all comes back to the data. It all comes back to the demonstrable change is being made in people's lives and systematically as a result of the people's lives being transformed. And it can all be totally calculated. I mean, we know how much it costs to significantly improve a year of someone's life, how many years can be significantly improved, how many years can be saved. This is all, when we talk in the context of African Mission Healthcare, we often say, we're in the business of buying DALYs, disability adjusted life years. How many disability adjusted life years can we buy? And the answer is a lot. And when you see how many disability adjusted life years you can buy for a donation, through African Mission Healthcare or through United Hatzalah, it's like, I want to do as much as I possibly can.
Oh, that's amazing. Mark, thank you so much for taking the time. Thank you for sharing the insights. Thank you for sharing the counsel, the advice. I really just can't thank you enough. I feel enriched. I'm sure everyone who listens to
thank you.
Your insights will feel enriched and grateful from what they've learned from you. So thank you. Before you go, may I ask you just to take a minute and tell people how they can be in touch with, learn more about African Mission Healthcare and you and everything else you're involved with.
Oh, well, thank you. So African Mission Healthcare is just africanmissionhealthcare.org. And over the next several months, all gifts that are made will be matched 100% by a combination of Erica and me and UBS, the bank. So because we just committed and gave a significant portion of $18 million. UBS is in for another $2 million. Some portion of that is a matching grant. So any gifts made, and a lot of the people matched have been coming in. So anyone who wants to give now, it'll be matched 100%, actually 105% if you're a UBS client. So it's a great time to give because there's 100% match on and a little more if one's a UBS client. And United Hatzalah is israelrescue.org. And it's been our goal with United Hatzalah for a long time to make this Israel's gift to the world, to bring it to the world. So if anyone listening is a mayor of a city, we can talk about that too.
Fantastic.
Yeah, absolutely. Those are the two websites. And I'm delighted to talk with anybody about how their generosity might be directed towards, for instance, a particular cause in Africa, whether it's cardiac care, whether it's maternal child, whether it's surgical training, that may really inspire them.
Fantastic. Well, again, thank you very much for the great work that you're doing, for the time you've taken with us today. We wish you every success in your continued efforts to save lives in Israel and Africa.
Thank you so much, Devin. I really appreciate it.
All righty. Let's do some good.
Thank you.
Thank you for tuning in to the Superpowers for Good show. Twice each week, we host changemakers who share their impact, insights, and superpowers. Don't miss another episode. Subscribe today at superpowersforgood.com. That's superpowers, 4, good.com. Be super empowered. Get your copy of the book, Superpowers for Good, as an ebook, audiobook, paperback, or hardcover edition via your favorite online retailer. Interested in having me speak to your company, organization, or association? Visit devinthorpe.com. Then let's talk. Now, keep using your superpowers for good. Together, we can reverse climate change, improve global health, and eradicate poverty.